Hello friends, if you want to know the details of tuberculosis, every topic of tuberculosis, that this is the channel you should follow and you should subscribe. And those who are following my channel, they know that this is the genuine channel and I am giving you information regarding tuberculosis, every fine detail regarding tuberculosis, and these are correct information. Friends, today's topic is safety of antitubercular drug in case of pregnant patient. Friends, there are differences between the treatment in an otherwise normal adult and in a pregnant patient, because those drugs which are used in tuberculosis, there are multiple drugs like first line drugs, second line drugs and reserve drugs. These medicines, there are multiple medicines, and these medicines have side effects like other medicines, and this because these medicines have side effect, so before starting on antitubercular treatment we have to consider the patient profile and the side effect of these drugs. If a patient is having some liver disease, then we definitely avoid those drugs, those medicines which can cause problems in the liver. Likewise, pregnant patient who is having a baby inside, we have to consider those drugs, those side effects, because some medicines are there which crosses the placenta and they affect the baby. There are fetal toxicities, and which is called teratogenic effect. So we have to avoid those medicine which cause problems in the baby, and we have to select the medicine which are safe. So to start with, I will discuss the first line drug first. Isoniazid is a safe drug. We can use it in pregnancy except very rare incidents of postpartum hepatitis. So it's rare, but in some cases there can be hepatitis or inflammation of liver after the delivery. Rifampicin and ethambutol both are safe in pregnancy. We can use them. Pyrazinamide is also considered to be safe, though there are not that much study or not that many studies are available regarding safety of pyrazinamide in case of pregnancy, but still we can use this. Now come to aminoglycosides. Streptomycin, usually used in relapse cases. This is not a safe drug. This can cause problems in the baby. Likewise, amikacin, captomycin, kanamycin, these are nephrotoxic and ototoxic. Baby can have problem in the kidney and ear because these hamper the development of ear. Then come to PAS or para-aminosalicylic acid. This drug is otherwise safe in pregnancy, though there are not that many studies are available. But if we can avoid, it's better to avoid. If there are no other options available, then PAS can be used. Cycloserine is totally contraindicated. This is not a safe drug. Ethionamide, prothionamide, these are reserve drugs. They are not safe in pregnancy, should be avoided in pregnancy. Fluoroquinolones are not safe in pregnancy, like ofloxacin, ciprofloxacin. These drugs should not be used because they cause problems in the baby. They usually crosses the placenta, so we should avoid these fluoroquinolones. Clarithromycin is not safe in pregnancy, should be avoided in pregnancy. Lastly, linezolid. Linezolid is a reserve drug. It is used in case of multi-drug resistant tuberculosis. There are not that many studies available regarding safety of linezolid in case of pregnancy. Though it can be used if there are no other options, then linezolid can be used in pregnancy. So these are the drugs safety or contraindication in case of pregnancy. I have tried to cover almost all the drugs. Thank you for watching this video and stay healthy.